Hello G Mamas! Today is a very special day because I'm here with Sheryl, Sidery, midwife and home birth coordinator in one of the public hospitals here in Sydney. And as you're probably seeing in my previous videos about the choice that I made having birth at home. Actually, I said in the video that the water birth and the home birth came to me in a vision and is a bit woo-woo for some people. But today I wanted to interview Sheryl to talk more about home births and her experience having so many of them and how they work. Especially because most people that when I say about home births and that I chose that option, they are so scared and they're like, oh, you are crazy, it's your first baby, why don't you do it in a second and a third and a baby? And that's one of the reasons why I wanted to do this video so much. So stick with me and I will come back in a minute and talk to you all about home births in Australia. Okay, so we are back with Sheryl. Sheryl, please talk about you and what you do today, your role at the hospital, how many births you've done.
So I decided to become a midwife about 35 years ago after I had my first baby. I have 4 children and 2 granddaughters. Wow. After the birth of my first child, who's 40 this year, I really felt there was something missing. I remember not really even knowing what a midwife was before I had my first baby. And I felt that the people who were caring for me in the postnatal period after having him really couldn't see how I was feeling. I felt superhuman. I had just given birth to a baby and I was able to breastfeed him and I felt so incredible. And I thought, I want to be that person reflecting back to women how incredibly powerful they are. Mm-hmm. So I had another baby and then did midwifery. And during my training, I was very disappointed. All the births back in the 80s were very medicalised. The women all gave birth on their back. They all had forceps. The midwives were more like obstetric handmaidens. And I remember feeling like I don't want to be that person either. I didn't know what was missing. And towards the end of my training, I met a midwife who had just done an apprenticeship with a home birth midwife. And there was something about the way that she spoke with the women and worked with them that was just this life-changing moment for me. And it was like, that is who I want to be. Mm-hmm. We still work together after all these years.
Really?
She's a very dear friend. So straight after finishing my training, I did an apprenticeship with a home birth midwife and have worked as an independent midwife ever since. So I always felt too that, private midwifery is probably the best care that a woman can have, but it is expensive. And I had this kind of, moral obligation that I felt that women who couldn't afford their own midwife also deserve to have excellent care. Mm-hmm. So I have worked in a public hospital, in a birth centre for many, many years, probably 20 odd years. Where women come in and motivated to have a natural birth, but in the hospital setting. So it's kind of the next best thing. It's a home-like environment. There were 8 of us working there for many, many years, and I loved working in that environment as well. So then recently, a couple of years ago, a public hospital was provided some funding to set up a publicly funded home birth model. Now, this isn't a new thing. There are 15 hospitals across Australia that offer women home birth out of the hospital. So essentially what that means is women are allocated their own midwife or small team of midwives to care for them throughout their pregnancy. And the woman then has a choice of having her baby in a labour ward with an epidural if she wants, or in a birth centre if that hospital provides that. Or she can also have the same team of midwives but care for her at home. So this is a choice that only about 1% of women in Australia choose. Yeah. So, and there's a whole variety of reasons for that. But it's been a wonderful opportunity to be able to expand the program and we just had our 45th home birth the night before last, which is a lot in
this particular
in the last 20 months.
Okay.
And probably there's been 25 women who were booked to have a home birth and then for a variety of reasons at the end of their pregnancy were cancelled for legitimate medical reasons. So in order for women to stay at home to have their baby, they have to be super healthy and have no risk factors. So that's a lot of women who've actually shown interest. And mainly that's because the women have a trusting relationship with the team of midwives that are caring for them, and that is imperative for women to be able to feel safe and secure enough to birth at home. It's very much about the relationship with the midwives. Yeah.
One of the things you actually mentioned about 1% that women would choose that. Why do you believe, like, what do you think the reasons are that women are not choosing more often home birth?
I think the last few generations of women are very fearful around childbirth. This is a very powerful state for women to be in. It's not just to do with the patriarchy. There's multiple layers to this. But women make choices around fear. And that is not a great place to be, to make decisions based on fear. So what's important when women are researching where is the best place for me to have their baby, it's vital for them to look at really solid evidence, and there is a lot of local and international evidence that supports that home birth is safe for low risk women. So where home birth gets a bad name is where women who are high risk opt to have their babies at home, and it's not a criticism of those women. Often women choose to take risks at home because they're unable to have the care that they want inside the hospital, and that's a problem with the system. It's not a problem with the woman. So if we just look at low-risk women, say if you have the same woman, so she's under 40, it's her first baby, she is healthy, she has no blood pressure problems or any other health problems, and so this study has been done across Australia. If that same woman chooses 4 different types of care, the outcome of that birth is completely different. So if she chooses a private obstetrician to have that first baby, she has about a 50% chance of having a cesarean.
Wow.
If that same woman goes to the GP and has shared care with a local hospital, it's about 35% chance of having a cesarean. If the woman has a team of midwives looking after her in a hospital setting, she has about, the chance of her having a cesarean section is about 25 to 30%. If she chooses a private midwife, where she only has one midwife looking after her throughout the pregnancy, her cesarean section rate is less than 10%.
Wow.
All of these women will bring a live baby at home, but that's the difference in what model of care that women choose. Now, again, it's not a criticism of women that want to go private, and it's, for some women, having an elective cesarean or a cesarean in their birth is not a bad thing for them. However, there's more to it than just having a live baby at the end of the experience. Who's going to look after that live baby? It's very much around how the mother feels about herself after the birth, how much respect and care she had during her labour and birth, and how she sort of emerges through that very transformational time of a woman's life. One of the main things that you want for women is that they feel powerful and strong enough to care for the baby, because the birth is a big thing, but caring for the baby is so much bigger. It's so much bigger. It's like being in therapy your whole life. So you want the woman to feel strong and resilient and to know how powerful she is. And so by denying her that, by sort of oppressing women to be fearful and, you know, you're not strong enough, you need to have an epidural, you can't do this, she never gets an opportunity to find out how strong she is. Now, I'm not anti-epidurals or pain relief. I think they have a very vital role in labours that aren't progressing normally. And we know that about 20% of women having their first baby will need some kind of intervention. And one of those interventions is an epidural. But what about the other 80%? Why can't we offer them a really positive experience?
Great point, because one of the things that people say, oh, you're crazy of having a home birth, is because people believe on certain risks. How early would you be able to say that to a woman that she wouldn't be able to choose home birth, for example? Or can everyone have a home birth?
No, definitely not everyone is suitable to birth at home. No, definitely not. We, as a profession in Australia, follow what's called the Australian College of Midwives referral consultation guidelines. And so in order for us to practice safely, we need to abide by these guidelines. And in order for women to birth at home, they need to be, healthy, one baby, head down, no previous caesarean section, don't have a high BMI, no mental health issues, suitable housing, support after the birth. So much of it is also to do with the psychosocial aspects, not just the physical aspects. Actually, what the evidence does say is women having their second baby at home, it's safer for them to be at home than in hospital. Whereas most other research says the evidence is the same. So so there's a fallacy, you see. Women think that, well, if I go to hospital, then, if anything goes wrong, then help is there. But midwives are trained to be able to deal with emergencies. We bring a lot of equipment to a home birth that we actually never use. We use like 3 things out of the bag, but we are trained to be able to deal with the obstetric emergency. And so for the women who choose home birth, they have an understanding that the very first intervention is getting into the car and leaving her warm, safe, familiar environment and going into an environment that's unfamiliar. Now, for women who don't want to stay at home, that clinical setting makes them feel safe. But for women who choose home birth, who believe that birth is, I guess it might sound a bit corny, sacred, sensual, natural, that being in her own environment actually enables her to give birth more safely than... Because often labour will slow down when women move from their home environment to the hospital. So that slows down, so they get there, it's not started again, we better give you some drugs to get it going. Those drugs make the contractions much more painful now, we better give you an epidural. The baby's not coping with that, the heart rate's now not normal, so you better have a caesarean.
Oh my God.
And so women think, thank God I was in hospital because I needed to have a caesarean. But what if you just stayed at home? What would have happened?
True.
This happens all the time.
It's like a snowball of intervention.
Yeah, we call it the cascade of intervention.
Yeah.
And women are led to believe that was essential. And that's a conversation that we could have forever.
Yes, definitely. And in terms of finding it out early, in my case, I waited until 36 weeks and I found out that I was fine about that, and also I am low risk, although I am geriatric mother.
we offer home births to women under 45, so you're
really?
not geriatric.
There you go. Yes.
You're way off that.
Way off that. I love it. So, even after 36 weeks, I could have, something.
You could have a visit at 39 weeks and your blood pressure's abnormal.
Yes.
Or the baby,
or breech or something.
Yeah, it's unlikely that your baby will turn now, but they can. So right up until you go into labour, everything has to be still low risk. Yeah.
Right. And if you are already in labour, you're home, your swimming pool is filled up, everything is set, your bowls and all your tools. What would happen that you need to be transferred to the hospital in an emergency situation?
So
because we do have the ambulance as well.
So it's actually very, very rare that we transfer in an emergency. I've attended over 500 home births.
Wow.
And the only time it's ever been an emergency with a siren on was not during the birth, it was afterwards, a woman who was bleeding quite heavily. And that is very rare. I mean, that's one that I can think of. I've had a few transfers in an ambulance because it's the most comfortable, convenient way to transfer the woman from home to hospital. But during the labour, if we had to transfer a woman, we don't use the ambulance, we just go in the car.
Yeah, right.
So the most common reason for women having their first baby to be transferred to hospital during labour would be it's taking too long. So we have, again, when I say too long, is that the progress needs to be steady. So the woman needs to be always making some kind of progress, and you can feel it. The woman can feel it as well. The labour should be progressing. It doesn't have to be in an exact time frame, but the woman needs to be dilating at a regular amount, and the baby needs to be moving down, and the labour needs to be progressing. So sometimes with a woman having her first baby, during labour the baby turns into a position that's not optimal, which slows the labour, the dilation is slow, And what's needed then is to transfer to hospital, to have a drip, have some rehydration, to have probably an epidural to try and relax everything to help the baby to turn around. Now, this is rare. It probably happens in under 10%.
Great.
So for a woman having her first baby that's planning to birth at home, as I said before, it's about 80% of women will achieve that. Yeah, which is much higher than, it's not 80% of women if they're in hospital to start with having her first baby. It's a lot less of those women go on to have a normal birth. And some of that is to do with the environment. Some of it's to do, because birth, in order for a woman to give birth normally, she needs to feel safe, unobserved and private. It's a very primal experience for a woman. And women need to be not interfered with all the time, not spoken to, not fiddled with. So they don't need the door opening all the time. You got the keys? You're going to morning tea now? You know?
Is your brain changing?
Just that, yeah. So she, in order for her to feel safe, unobserved and private, she needs to have a relationship with her caregivers. Although that's not absolutely imperative, but it definitely helps. She needs to have a really solid support person, which you have. And for women who choose home birth, being in their own environment is what helps them to feel private and unobserved. It's not that women can't necessarily feel like that in hospital.
Some of them even feel more comfortable in hospital.
But it's not safe, unobserved. It's not unobserved and private, is it?
No.
So it's no wonder that labour often takes a long time in hospital. We say that the cervix is a very shy part of the woman's body, and so, you know, it's a sphincter that in order to relax and open, women need to feel unobserved. So this is why, I guess, since the 80s we've been using birth pools, because when women are in water, it does give them a sense of privacy, and they don't feel observed and as vulnerable, because the water is kind of a barrier between...
It's like your cover somehow.
Exactly,
That's an interesting point.
So our water birth rate is around 80% of women who birth at home birth in water,
That's great. Yeah, actually most cases I've seen in documentaries as well, I think I would say more than even 80% would be on a pool.
Often the only reason they don't birth in water is it happened very quickly and we weren't ready. Like the birth last night, who was just a few doors up from this house actually. We're madly trying to get the pool ready. And she was, the baby was coming.
Baby?
No, second. The baby was coming, and she was like, "Oh, don't worry, I'm just going to have the baby here." And I was thinking, I've just spent half an hour getting this pool ready. So I said, "Why don't you just hop in now?" And she hopped in, and the baby just came straight out, and she just went, "Oh my God, that was everything. Getting into that pool was everything."
It's one of the coping mechanisms.
Yeah, it really, really helped. Yeah.
Good point to enter, because people also ask me, what would be your options to cope with pain when you are at home? So first of all,
we don't use the P word.
Yeah, we don't.
It's a strong sensation.
That's true. That's a strong sensation. I was explaining that to my parents this weekend, because we all use surge instead.
Yes, that's right.
And one of the things that I definitely recommended before, but I will continue recommending, is that you, wherever you are watching this video, please try and do a birth course with someone that is experienced and have good credentials in your area. I've done it with my husband and thought that was an extra step, doing all the education and watching videos, documentary, and also talking to doulas and courses that really educated us how we will cope with, how do you say, not pain?
Strong sensation.
Strong sensations during...
It's only 1 minute. That's all you have to do is 1 minute.
I love that. You can do anything for 1 minute.
It's so true.
Especially if you had endometriosis before, like me. Yeah, so what would be other than being educated about the home birth, what would be the other things?
Eating really well, and staying active and healthy. Yeah.
Throughout the pregnancy.
Particularly the last month. Like walking every day. If the woman is able to do some yoga, meditation. Walking helps to keep the baby in a good position. Yeah. Because we don't actually have any control over what the baby does in labour. So in order for the baby to come out, it needs to be in what we call an optimal position. Lying on the couch every day watching Netflix is not the best thing to do in the last month of your pregnancy or of a woman's pregnancy. You know, she needs to be upright. She needs to be resting as well, but you know, keeping fit and active, keeping the thighs strong, and yeah.
That's interesting, because I think in the last few weeks I've been OCD nesting person, so I'm really tired and I really want to lay down sometimes, but I feel, and I do eventually, but I feel like, no, I need to wash these clothes.
That's great. Nest.
Doing everything is very natural.
It is, yeah.
I hear it, yeah. And in these big bags, you will see in the corner of the video here, guys, on the last week when I was 36 weeks, the midwives came to inspect. Do you call inspection home inspection?
Not really. I just like to get a feel for what the house is like, what the hot water is like, you know, how we're going to attach the hose to the pool, and just like to get a bit of a feel.
Practical and steps.
Yeah, because when we come, we need to know how to get here, and where's the front door, and where do we park, and all those things.
Yeah, that's important. Yes, and they bring 3 big bags. One is a big luggage, and then 2 other ones. What is this? That is. Most
of it is equipment for if there was any kind of emergency. But as I said before, we mainly just use a cord clamp to clamp the cord off, which again, you know, it's not even really necessary. You could just leave the placenta attached, but that's another story.
Yes.
Yeah, so it's mainly just, you know, in case we need to intervene in any way. But, you know, we very rarely use all those things. You know, some women need to have a few stitches after the birth. The midwives have all that equipment there. They needed to have some sort of drip if they were having some blood loss.
Oh, really?
You know, intravenous fluids, yeah.
Oh.
But, yeah, mostly we don't use any of it. There's some baby scales in there.
Oh.
Resuscitation equipment for the newborn. If it's very, very rare, but sometimes babies need a bit of help to breathe when they first come out. And yeah, so we do home birth drills every 3 months at the hospital. I run a program where the midwives who are doing home births must attend, and you know, we do it all on the floor as though it's in the home. It's like a simulated environment, so the midwives are, you know, they're learning it by rote. They're practicing these skills regularly. So, you know, this is what we do. If this happens, that happens, this happens. So they're highly skilled professional healthcare workers. I have the utmost confidence in them.
Yeah, me too. And when we are clear to have a home birth, what is the window that you can have a home birth? Between 37 weeks
and 42.
To 42?
Yeah, 42.
Wow. Yeah. I thought 40, and after that you would need to be induced.
No.
No.
Well, not if the woman wants to be, but... No.
We don't.
Well, if there's no actual obstetric reason to be induced, then why would you?
Yeah, right.
So after 41 weeks, the woman needs to have regular checkups between 41 and 42 weeks. But if she goes to 42 weeks, she can still give birth at home.
Also, what can we expect? What is the natural thing that happens? So when we are in labor, we call. What's the procedure? Who comes? How close to delivery they come?
Often it might be kind of multiple phone calls leading up to when the midwife actually comes. Usually the midwife can tell over the phone whether it's time for her to come. Sometimes the woman will want her to come and visit, but the midwife might not stay. She might come, hang out for an hour or two, just see how things are going. Usually when you're having your first baby, often women do ring a bit too soon. And there's no point in the midwife being here because, again, you don't want to feel observed the whole time.
Yeah.
Sometimes she might come and then leave and come back later. She'll call the second midwife when the birth's getting a bit closer, depending on who's coming. Sometimes 2 midwives might come together early in the piece. It just depends.
And this is because they would check if you are dilating, or
if the woman wants that.
Oh, really?
Yeah.
But it doesn't necessarily mean that we need to check that.
No.
Wow.
We can usually just tell with how she's behaving.
Right.
How far or close she is. And you read in the paper, woman gives birth by the side of the road, woman gives birth in the taxi.
Yeah.
You never read mother and baby died.
Yeah.
In fact, you know what you read? The dad was the hero.
Yeah.
That you can imagine. That
I can imagine
really annoys me. It's not how amazing was the woman. It's like the dad did this great job. It's like, no. it's actually very rare with women having their first baby that it's that quick, but it's a great thing when it does happen.
It's I suppose that when you have your first as well, your body and your mind, you still don't know what kind of pain you are dealing with as they
Is that word again? What kind of strong sensation?
I have to stop saying pain. So you're not used to this level, of your body probably never felt anything like that. So when you call, you're like, is this the worst? And then you mentioned something when you came here last week, saying that if you can talk, if you even can say a sentence, you're probably very early.
Yeah. What happens when your labour starts, when a woman's in labour, her body is flooded with very powerful hormones that have the effect of making her feel really quite out of it. Women they have big dilated pupils, red lips, flushed face. They're very non-communicative. They're not talking to the people in the room. They're deep inside. And often when women are in that sort of trance-like state, they're very relaxed and they're just focusing on their breath. And afterwards they will say, that was actually a lot easier to handle than I kept waiting for it to get stronger, and it actually never did.
Wow.
Yeah.
That's really
they may not feel like that in the moment.
Mm-hmm.
They may be expressing the sensations, in a way where for the people watching you might think she looks uncomfortable, but afterwards women will often say, that was actually fine. So those women, when the baby comes out really, really quickly like that, it's called the fetal eject reflex. It's absolutely possible, but it's actually quite rare. Those women have been able to produce huge amounts of birth hormone, probably because they feel safe, unobserved in private, and the baby is literally just expelled without the woman even needing to help. The baby just comes. It's still a mystery. We don't know why this woman has a really fast labour and this woman takes 3 days. We still don't really understand it. I mean, one of the easiest things to do in labour is to not focus on the sensation, but it's also the most difficult. So when women don't put all their attention on that sensation, they're able to breathe through labour. But it's very difficult to do that.
Yeah.
Like, we're the only mammal that describes birth as being painful. If you think about all other mammals that give birth, they don't look upset by it.
I think it's a lot of the last 20-30 years we've been more involved in media and movies tend to represent birth
and look how badly they do that.
Yeah,
contemporary images of birth it's always the same scene. The woman is screaming and bitchy and out of control. The dad is portrayed as being this idiot who can't find the car keys, running around in circles, and there's always a drama at the end. And the hero doctor comes in. These days it's a woman, just because that's going to make... And, saves everybody. It annoys me so much. They never portray birth how it actually is, which is the most powerful psychosexual experience of a woman's life.
Yeah, and I have never seen, not that I remember, a modern movie represent home birth at all. We don't need that disservice.
No.
So, after the birth, baby is well, everyone is well. How long the midwife stays, why they stay, and what reason?
We stay about 3 hours after the birth. I mean, we tidy up everything. We want to make sure that the woman can help attach the baby to the breast. One of the loveliest things about home birth is the time afterwards. It's very satisfying to tuck everyone into bed and just creep out. And just know that there's a whole family just being born. It's something I never tire of, that in that moment just before the baby comes, that there's 4 people in the room and suddenly there's 5.
Yeah, that's lovely.
There's always tears and we always share a meal and it's just, sometimes it's longer. And then the midwives come every day or every other day in that week or 2 after the birth to check how the breastfeeding's going and, teaching you parenting skills So this is a good time to start reading about breastfeeding and caring for baby.
How do you think women need to be flexible even if they have the birth preference, including myself having a home birth preference, if that doesn't happen in the end? Or how,
it's pretty important to be flexible and to trust your caregivers and to realize that, you know, the woman can have all her dreams and plans, but the baby may have a completely different plan.
Yeah.
You know,
and most of the time is the case, including the due date.
Exactly. And that's still a mystery. We don't really know. We know that the baby produces a hormone that goes into the bloodstream of the mother to stimulate the pituitary gland to produce hormones to make labour start. But what makes the baby produce that?
So the baby
initiates labour. Yeah.
That's lovely.
We don't really understand why. If they understood that, they may be able to prevent very premature births.
Yeah.
Yeah. It's kind of nice that it's a mystery.
It's spiritual, I think. That's beautiful. That's very lovely.
I remember reading something once that wasn't very clear, but it kind of made sense that at the moment your baby is having all of its nutritional and energy requirements being met by you.
Mm-hmm.
At some point, the baby will realise that in order to have all of its energy requirements, it needs to be born.
Wow.
So that kind of explains why women with high blood pressure, or, you know, women who smoke a lot of cigarettes or who are very under or overweight tend to have their babies earlier.
Mm-hmm.
And whereas very healthy women who nutritionally really at their peak tend to go past their due date.
Mm-hmm.
So it's like all the needs are being met. Oh, actually, I need to be born now. Yeah.
That's
so interesting.
Nice.
Yeah.
Very interesting. We should have more research on that. All the questions that people ask me, most of them we cover here. If you have any more questions, please let me know, and then I will still keep in touch with the midwives, the hospital, and I can still come back to you on those in the blog and update the content. I'm very grateful that you came all the way over here, and it's teaching me and my husband, and hopefully you'll be here for the birth, but
I hope so too.
We are flexible as well on that. So thank you very much for your time and for being here.
Thank you.
And one more question that I have is that if women are not able to have their home birth subsidized in their hospital, can they have private midwifery services?
Yes, there are privately practicing midwives all over Australia.
How can they find it?
In Sydney, you can access a private midwife through the Home Birth Access New South Wales website. They have a whole list of practitioners that you can contact through their own websites. Yeah,
I will put the link down below here for you guys. Don't expect the home birth means that you are not assisted, please. Home birth.
No, free birth is very different to having a midwife there.
Yeah. Okay. Thank you so much for everything and for being here.
Thank you.
And I hope that if you are pregnant and expecting soon, that you have a great labor. Whatever happened to your pregnancy and whatever happened to your choice, it's that it will be a good memory and for you to tell your baby and other people soon. Thank you so much for watching. Bye bye.